From KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. Patients in Colorado feel the brunt of a growing healthcare crisis every day. There's a shortage of primary care doctors and other healthcare workers in most Colorado counties. And that has an especially big impact on low-income and rural communities. That physician shortage is projected to get even worse, with roughly a third of doctors in the state age 60 or older and nearing retirement, according to a recent report by the American Association of Medical Colleges. To help boost the number of primary care doctors, a new medical school, just the third one in Colorado, is being built at the University of Northern Colorado in Greeley. UNC officials celebrated the groundbreaking for the new College of Osteopathic Medicine on September 28th. The new school has a price tag of around $200 million and will eventually graduate 150 new doctors each year when it opens in 2026. We spoke with the very first dean of the new medical college, Dr. Beth Longenecker, back in May when the school was first announced. Today, we're listening back to that conversation. Now, you helped make the case for this school, and you spent years on the vision. It's a $200 million project. Was there a moment early on that really crystallized for you the seriousness of Colorado's doctor shortage?
Well, having come to Colorado about 2 years ago to start our new College of Osteopathic Medicine, I've been traveling around the state speaking to physicians and hospital administrators about the potential for having our students rotate with their physicians to learn their clinical skills, and also finding that there are significant health shortages, especially in our rural communities. And speaking with individuals all across the Eastern Plains, it's clear that they are importing physicians, they are importing nurses, they're really facing a shortage of physicians in our region to the extent where they have housing available now because they'll be bringing physicians in for 1 to 2 weeks to cover their intensive care unit or their emergency department. And our hope is that we can leverage the population that already seeks to come to UNC, the first generation students, the students who are coming from our rural areas of the state, and provide a pipeline where they can come to medical school and go back home to their communities to help the folks that they grew up with.
And this issue is personal for you. You grew up as the daughter of an osteopathic doctor, or DO, in Pennsylvania. I'm wondering how that experience shaped your work.
Well, my father was a primary care physician in rural Pennsylvania. He was a DO. He graduated back in the 1950s when DO was still this big mysterious thing that nobody was quite sure what a DO was. And, I grew up in a really small town of about 1,200 people. And he was the town doctor about 25 miles from the nearest hospital. And we would have people knocking on the door any time of the day or night wanting to see the doctor. I would get into the Jeep with my dad if my mom was at the grocery store and he had to go on a house call. And we'd go out to the different neighboring farms and the neighboring houses just to see the patients. And I think it really registered with me that first, my dad was a huge member of that community, and he wasn't only impacting the lives of his patients, he had influence within the community when questions would come up about health and about wellness in the community. He also was really there for his patients, and that connection really, really inspired me. And that's one of the reasons I sought to become a DO, because I really enjoyed that patient-physician relationship he develops.
Yeah, and actually you bring up a great point. UNC's new medical school will specialize in osteopathic medicine. Maybe it's less mysterious than it used to be, but I think it still, not everyone knows. The graduates will have a DO after their name as opposed to doctors with an MD. What is the difference?
Well, osteopathic medicine started in the late 1800s, and it was started by an MD by the name of Andrew Taylor Still. And he really did not like the way medicine was being practiced. He saw, this was, of course, the time of leaching and, very toxic medications.
Yikes.
And he said, there's got to be a better way to do things. And one of the primary tenets that he came up with in his philosophy of medicine is that when you look at your patient, you have to understand that your patient is a unit of mind, body, and spirit. And anything that impacts your body can impact your mental well-being or your spiritual well-being. Anything that impacts your spiritual well-being or your mental wellness impacts your health. So the approach in osteopathic medicine is very holistic and very much looking at not just the patient, but their background, what's going on in their family, what are their stressors are in their lives. And that's really ingrained in our philosophy and in how we teach our students. One of Andrew Taylor Still's most popular quotes is, "It's the physician's role to find health. Anyone can find disease."
Oh, interesting. Well, coming back to the new College of Osteopathic Medicine at UNC, the new medical school will graduate about 75 new doctors soon after it opens. That number is set to grow to 150 a year over time. Is the solution to the severe doctor shortages simply a matter of cranking out hundreds of new doctors in Colorado? How do we get at this tremendous need?
Well, I think it's more than just graduating new doctors. We have to look at how do we attract individuals from our region to the medical school? Because if you're from the state of Colorado and go to medical school in the state, the literature out there shows that about 20 to 25% of those young graduating doctors will stay in the state when they open their first practice. If we can build additional training, because the way medical education works, you go through 4 years of medical school, and then you go into a residency program. And those residency programs train you to be whatever specialist you're going to eventually become, a family medicine doctor, a pediatrician, a surgeon. And they are anywhere from 3 years to 5 or 7, even for some of the subspecialties. And if you look at the same literature, if I'm born in Colorado, go to medical school in Colorado, and go to a residency program in Colorado, about 75% of those students will graduate and stay in Colorado to practice. So we also have to focus on where can we develop additional residency training programs for our graduates. And that's one of the things we're working on as well.
And given that a large concentration of the physician shortage is around primary care physicians, is there an advantage to UNC's new medical school specializing in osteopathy?
Well, when you look at osteopathic medicine overall, currently the statistics are that 58% of practicing DOs are practicing primary care specialties. That would be internal medicine, family medicine, pediatrics. It's only about 28% of our MD counterparts. So having an osteopathic medical school is more likely to generate additional primary care physicians and really meet that healthcare need that we have in our state.
All right. Well, hey, let's spin this out 10 years or 15 years. What are you envisioning in terms of the overall healthcare landscape because this school is opening in 2026?
Yeah, 10 years from now, I'd really love to see that our graduates are choosing to practice in rural or underserved areas of the state. I would love to see a large percentage of our graduates practice in the state of Colorado and in Weld County, where we're located here at UNC. I'd love to see us really have our graduates understand their role, not just in helping patients, but also their communities.
Dr. Beth Longenecker of the University of Northern Colorado, speaking with me back in May about the new medical school being built there now. And that's it for us today on In The NoCo. I'm Erin O'Toole. Thank you so much for listening.